Welcome to the Deep Dive. Today, we're focusing on a topic many of you might have questions about, maybe for yourselves or someone you care about, breast disorders.
Yeah.
Our goal is really just to provide some clear, useful information to help make this whole area maybe a bit less confusing.
Exactly. And we've been looking through a chapter from a medical surgical nursing textbook, sort of to give a solid base for understanding the different conditions that can affect the breast.
Okay.
We'll be highlighting, the key signs and symptoms, looking at what causes these disorders, and outlining how they're typically managed.
So think of this as getting the essential knowledge, hopefully helping you feel more informed and maybe less overwhelmed when breast health comes up, either in conversation or, in your own life.
Right.
Okay, let's get right into it then. Our source, it neatly groups breast disorders, which honestly seems like a smart way for us to tackle this.
It really does help structure things.
So we're going to look at infectious and inflammatory disorders first, then move on to benign breast lesions, then discuss malignant breast disorders, which is, well, cancer.
Right. The one people often worry most about.
And finally, we'll touch on cosmetic breast procedures too.
That categorization, it really does help see the bigger picture of breast health, doesn't it? It's important to keep in mind that while some things are common and maybe not serious, others really do need prompt medical attention.
Okay, good point. Let's start then with those infectious and inflammatory disorders. The textbook puts a spotlight on mastitis first. What's the main takeaway for us on this one?
Well, what's interesting here is the main cause, usually blocked milk ducts in the breast.
Okay.
And this often involves a pretty common bacteria called Staphylococcus aureus. The textbook points out this mainly affects women who are breastfeeding.
Right, lactating women.
Exactly. So the key things to look out for are a fever, feeling generally unwell, malaise, and then specific breast symptoms like tenderness, pain, redness, maybe a hard feeling in the breast. Sometimes there might even be a crack in the nipple and maybe enlarged lymph nodes under the arm on that side. Okay.
A key insight here is that even with antibiotics, you really need to keep emptying the breast. That's vital to clear the infection and prevent complications.
So how do doctors actually figure out if it is mastitis?
The usual way is by taking a sample of breast milk that's been expressed, and doing what's called a culture and sensitivity test.
Okay, what does that do?
Well, it's a test where they grow any bacteria that might be present to identify it, and also to see which antibiotics will work best against it.
Makes sense.
And treatment generally involves antibiotics, obviously, to fight the infection, pain relievers, analgesics, and maybe applying heat to the area. And importantly, the breasts need to be emptied regularly, often using a pump. And sometimes systemic antibiotics, taken by mouth or IV are needed.
Our source actually had a true or false question on this. Mastitis occurs in lactating women as a result of plugged ducts. And the answer is true. But there's a really practical point in the explanation too, isn't there? Absolutely. The explanation clarifies that while you're using antibiotics to treat the infection, the breast milk might actually need to be pumped and then temporarily discarded.
Oh, right.
Yeah, so the baby doesn't get the medication through the milk. That's a really key piece of information for anyone breastfeeding and dealing with this.
Definitely. Now, another condition under this same sort of inflammatory umbrella is a breast abscess. How is that different from mastitis?
Well, a breast abscess can often develop as a complication, maybe if postpartum mastitis isn't treated effectively.
Okay.
And similar to mastitis, S. aureus is frequently the culprit, the cause. The symptoms will be like mastitis, but with one crucial extra sign: actual pus-filled drainage coming from the nipple.
Oh, wow. That sounds quite alarming.
It does, yeah.
So how is a breast abscess diagnosed and treated then? Is it similar?
The diagnosis, again, involves taking a sample of that nipple drainage and culturing it to see what bacteria is growing. But the treatment is usually a bit more involved. It often requires a hospital stay and something called contact isolation, basically precautions to stop the infection spreading.
Right.
Intravenous antibiotics are typical, and the abscess usually needs to be physically drained. There's a procedure called incision and drainage, or IND.
IND, okay.
Yeah, where they make a small cut to let the pus out.
Okay, let's move on then to the next category. Benign breast lesions. So these are non-cancerous.
Correct. Benign means non-cancerous.
The first one mentioned is fibrocystic breast disease. I think a lot of people have probably heard that term. What exactly is it?
Yeah, it's quite common. Essentially, fibrocystic breast disease just means having benign, so non-cancerous, cysts in the breast. Interestingly, the textbook mentions that things like caffeine and nicotine might make it worse for some people.
Mm.
And it's more common in women between the ages of, say, 30 and 50. Maybe a quick takeaway here. Remember that 30-50 age range and the link to hormones for these fibrocystic changes, breast pain that comes and goes, lumps, especially around your cycle, those are the hallmarks.
And what are the typical signs someone might experience then?
Well, the main things would be breasts that feel tender and painful, often with multiple lumps you can feel.
Okay.
There can also be breast pain that sort of comes and goes. That's called mastalgia. And these symptoms are often influenced by hormones, so they might get better or worse throughout the menstrual cycle.
Right, that makes sense. How do doctors diagnose it?
Diagnosis usually involves a few things. A physical breast exam, obviously,
Okay.
and sometimes a cytologic examination where they look at cells under a microscope for anything abnormal. Imaging like mammography and ultrasound are also really common.
Okay.
And sometimes maybe a small tissue sample called an incisional biopsy might be needed just to be sure and rule out other issues.
And how is it managed? Is it something you just live with, or?
Yeah, management really focuses on relieving the symptoms because it's benign. So this can include just over-the-counter pain relievers, analgesics.
Right.
Sometimes, believe it or not, oral contraceptives can help because they regulate hormone levels.
Oh, interesting.
Yeah. If cysts are particularly large or bothersome, they might be drained with a needle or sometimes surgically removed. In really rare, very severe cases, a mastectomy might be considered, but that's definitely not typical.
Okay. The textbook also has another true or false for us here. Fibrocystic breast disease occurs in women of late adolescence to young adulthood, and the answer is false. What's the key difference we need to remember?
Yeah, the explanation points out, like we said, that fibrocystic breast disease is more common in women between 30 and 50, whereas another benign condition, fibroadenomas, those typically occur in younger women, think late teens into their early 20s.
Uh-huh. Okay.
So that age difference can be a helpful clue for doctors.
Right. Well, speaking of fibroadenomas, let's talk about those next then. What are they?
So fibroadenomas are also non-cancerous breast lesions, and like fibrocystic changes, they seem to be influenced by hormones too.
Okay.
But a key difference is that they often show up as just a single lump in the breast. And importantly, this lump usually doesn't change much in size or how it feels during the menstrual cycle.
Unlike the fibrocystic ones.
Exactly. And as we just mentioned, they are more common in that younger age group, late adolescence and early adulthood.
What would someone typically notice if they had one? Is it painful?
Usually not. The typical finding is a painless, non-tender lump.
Okay.
It's often described as being encapsulated, meaning it feels like it has distinct borders,
Mhm.
and it's mobile. You can sort of feel it move around easily under the skin, and it usually feels quite firm.
How are these diagnosed then?
Diagnosis often starts with an ultrasound just to get a good look at the lump.
Right.
An excisional biopsy is common too. That's where the entire lump is surgically removed and then examined under a microscope to confirm it's definitely a fibroadenoma. There's also another imaging technique, tomosynthesis, which is a kind of 3D mammography that can sometimes be used.
And what's the usual management approach? Do they always get removed?
Not always. It kind of depends. Depends on its size, whether it's causing any symptoms like pressing on things, and also what the person prefers. Management can range from just watchful waiting, observing it over time to see if it changes, all the way to surgically removing it.
Okay. Now we're moving into a category that I know is a major concern for many people.
Yeah.
Malignant breast disorders or breast cancer. What's the basic idea here?
Right, so malignant means cancer. It refers to a growth of abnormal cells that, unlike benign lesions, can invade nearby tissues and also have the potential to spread or metastasize to other parts of the body.
Okay.
The textbook highlights a couple of really significant risk factors, just being female, unfortunately, and being over the age of 50.
Right.
Also, having certain inherited faulty genes, like BRCA genes, can greatly increase the risk. Maybe a quick insight here. Remember that stage I cancer is contained and generally the most treatable. Stage 2 means it has spread, and the focus shifts more towards management, not necessarily cure. Early detection through screening makes a huge difference in outcomes.
Absolutely.
Hmm.
What are some of the signs and symptoms beyond just a lump that might suggest breast cancer?
Yeah, well, a painless lump is sort of the classic sign people think of. There are definitely others to be aware of.
Okay.
Things like bloody fluid coming from the nipple, a dimpling or puckering of the skin on the breast, almost like an orange peel texture sometimes.
Right.
Also, the nipple turning inward or retracting when it didn't before. A noticeable difference in size or shape between the breasts. And that orange peel skin, the French term is peau d'orange, where the skin gets thick and pitted.
So quite a few things to watch for. How is breast cancer actually diagnosed?
The main diagnostic tools are imaging and biopsy. So mammography, the breast
Oh.
X-ray, breast MRI, which uses magnetic fields to get very detailed pictures, and ultimately a biopsy is needed for a definitive diagnosis.
And that's taking a tissue sample.
Exactly. A small tissue sample is taken from the suspicious area and examined under a microscope to see if cancer cells are present, and if so, what type they are.
Okay. The management sounds like it could be very complex. The textbook mentions it really depends on the stage of the tumor. Could you unpack that staging concept a bit?
Sure. Staging is really important. It basically describes how large the cancer is and whether or how far it has spread beyond the breast.
Okay.
Our source actually had another true or false. Breast cancer is staged, with stage I being the most advanced, and that's false.
Right. False.
Yeah, it's really crucial to understand that stage I is the earliest stage. It means the cancer is small and hasn't spread outside the breast tissue.
Got it.
Then it progresses through stage 2 and 3, which indicate larger tumors or spread to nearby lymph nodes, like under the arm. And stage 3 is the most advanced stage, meaning the cancer has metastasized. It's spread to distant parts of the body, like bones, liver, lungs, or brain.
And the treatment plan is tailored based on that stage.
Very much so. The stage heavily influences the treatment options and the overall prognosis.
What about the surgical procedures? The textbook lists quite a few different types of mastectomies and things.
Yes, the surgical options vary quite a bit depending on the situation. They range from less extensive to more extensive.
Okay.
You have a lumpectomy, which just removes the tumor and a small margin of normal tissue around it, sometimes called breast-conserving surgery.
Right.
Then there's a partial or segmental mastectomy, removing a larger section of the breast. A simple or total mastectomy removes the entire breast tissue, but maybe leaves the skin or nipple.
Mm-hmm.
A subcutaneous mastectomy is similar, removing tissue but leaving skin and nipple, often done with immediate reconstruction in mind. A modified radical mastectomy removes the entire breast and some of the lymph nodes under the arm. And then a radical mastectomy, which is much less common now, removes the breast, the chest wall muscles underneath, and all the underarm lymph nodes.
Wow, that is a wide range. It's quite sobering, actually.
It is. It really highlights how differently breast cancer can present and how tailored the treatment needs to be.
So how is the decision made about which surgery is right?
Well, it depends on several factors. The stage and size of the tumor are key, obviously, but also the tumor's characteristics, the patient's overall health, and importantly, what the individual decides after discussing all the options, risks, and benefits with their medical team.
Right. Informed decision-making.
Exactly. And the textbook does point out a really significant trend in medicine, which is generally towards performing the least disfiguring surgery possible that will still effectively treat the cancer.
That's good to hear.
Yeah. It also mentions a potential complication after surgery, especially if lymph nodes are removed, called lymphedema.
The swelling.
Yes, swelling in the arm on the same side as the surgery. Because the lymphatic drainage has been disrupted, it requires careful management.
Okay. Let's talk about when breast cancer does spread. The textbook discusses metastatic breast cancer. What exactly does that involve?
So metastatic breast cancer is when cancer cells from the original tumor in the breast travel and set up new tumors in other parts of the body.
Okay.
The textbook outlines a few ways this can happen. By growing directly into nearby tissues, spreading through the lymphatic system, traveling through the bloodstream, and sometimes even through the cerebrospinal fluid, the fluid around the brain and spinal cord.
Wow. Where does it typically spread?
Common sites for breast cancer metastasis include the lymph nodes, often the first place, also the bones.
Which can cause pain, right?
Exactly. Bone pain is a common symptom, and sometimes even pathologic fractures, where the bone breaks easily because it's weakened by the cancer.
Okay.
Other common sites are the lungs, the brain, and the liver.
So what are the signs and symptoms specifically of metastatic disease?
Well, besides any ongoing signs related to the original breast cancer, people might have symptoms related to where it has spread. So like we said, bone pain. Or if it's in the lungs, maybe shortness of breath or a persistent cough. If it's in the liver, maybe jaundice or abdominal pain. If it's in the brain, headaches, seizures, or neurological changes.
Right. And how is metastatic breast cancer diagnosed and managed? Is the goal still cure?
Diagnosis usually involves imaging tests, x-rays, MRI, CT scans, PET scans to find out where the cancer has spread. Sometimes a biopsy of a metastatic site is needed.
Okay.
In terms of management, for stage 4 metastatic breast cancer, the primary goal usually shifts from cure to palliative care.
Palliative meaning.
Meaning the focus is on controlling the cancer's growth for as long as possible, managing symptoms effectively, and maintaining or improving the person's quality of life. It's about living with the cancer.
Got it.
Treatment options can include things like hormone therapy, targeted therapies based on the cancer's specific characteristics, chemotherapy, radiation therapy to treat specific symptomatic spots, and immunotherapy.
Okay. Now, for women who know they have a higher risk of developing breast cancer in the first place, maybe due to family history or genetics, does our source mention any preventative steps they might consider?
Yes, it does. The textbook discusses several strategies for women identified as being at increased risk.
Like what?
Well, one is simply having regular long-term medical follow-up and surveillance, maybe more frequent screenings. Another, more drastic option is a bilateral prophylactic mastectomy, surgically removing both breasts before cancer develops to significantly reduce the risk.
Right, a preventative mastectomy.
Exactly. And then there's also using medications for chemoprevention. The book mentions drugs like tamoxifen and raloxifene, which can lower risk in certain women. Even NSAIDs have been looked at.
Interesting.
But it's really important to note, according to this source, that the role of diet in breast cancer prevention is still considered inconclusive. And also, these preventative medications, they definitely can have side effects, so it's a decision that needs very careful discussion with the doctor, weighing the risks and benefits.
Absolutely. Okay, finally, the last category we wanted to cover is cosmetic breast procedures. The textbook describes a few of these. Let's start with breast reconstruction.
Right. So breast reconstruction is surgery that's done to rebuild the shape of the breast, usually after a mastectomy for cancer treatment.
Oh.
The goal is to create a breast mound that looks as natural as possible. This can sometimes also involve reconstructing the nipple and the areola, the darker area around it.
How's it done?
There are two main ways. One is using artificial implants, which can be filled with either saline saltwater or silicone gel. The textbook does note there were some higher complication rates with earlier silicone implants before newer versions were approved by the FDA. The other main approach is using the patient's own tissue, taken from another part of their body, like the abdomen or back. This is called autologous reconstruction, and it can often give a more natural look and feel, though it's typically a more complex surgery.
Okay. What about breast reduction or reduction mammoplasty?
Reduction mammoplasty is surgery to make the breast smaller.
Right.
This is often considered by people who have very large breasts.
Like?
The book mentions maybe a D cup or larger, and experience physical problems like back pain, neck pain, or skin irritation because of the size and weight. It's usually a surgical procedure that requires an overnight stay in the hospital. And there's a related procedure called opposite breast reduction.
What's that for?
That's sometimes done to make a healthy remaining breast smaller so that it matches the size and shape of a breast that has been reconstructed after cancer surgery to improve symmetry. The techniques are pretty similar to a standard reduction.
Got it. And I've also heard about breast lifts. What do those involve? Is that different from reduction?
Yes, it's different. A breast lift, the medical term is mastopexy, is specifically done to correct sagging or drooping breasts, what's called bantosis.
Okay.
It also aims to raise nipples that might have dropped too low over time due to things like aging, pregnancy, or weight changes. So it basically tightens the skin envelope and reshapes the breast tissue to give a more lifted, youthful appearance, but doesn't significantly change the size.
Right. Then there's breast augmentation. That one's pretty well known.
Yes. Breast augmentation is a cosmetic procedure purely to increase the size of the breasts. According to this source, it typically uses saline-filled implants.
Okay. And lastly, the textbook touches on the nursing care involved in these cosmetic procedures. What does that generally entail?
Well, nursing care for cosmetic breast surgeries involves care both before the surgery, preoperatively, and after postoperatively.
Makes sense.
Post-op care includes things like positioning the patient properly, often in a semi-upright, semi-Fowler's position, to help with swelling and comfort. Managing pain effectively is crucial. And providing really important patient teaching. This includes instructions on wound care, signs of infection to watch for, the ongoing need for regular mammograms, even with implants, and how to do breast self-exams.
Right.
Also, advice on wearing supportive bras during recovery, and clear guidelines about when and how to safely resume activities and exercise.
Well, that's a really comprehensive overview.
covering quite a bit of ground based on our source material. It really shows the wide range of conditions, from infections to benign lumps to cancer, and even cosmetic options related to the breast.
It does. And what's fascinating, I think, is considering how many different factors can play a role in these conditions.
Mhm.
Everything from simple infections and hormonal fluctuations all the way to our genes and, well, aging.
Yeah.
Understanding these underlying processes, it's just so important for getting an accurate diagnosis and figuring out the most effective treatment.
So, what does this all mean for you listening at home? I think it really highlights how crucial it is just to be aware of your body, aware of any changes in your breasts, and to not hesitate to seek medical advice if you have any concerns at all.
Exactly.
As we've discussed, there's this whole spectrum of breast disorders, right? From things that are really not serious, thankfully, to those that are malignant. And understanding the differences, knowing what to look for, is absolutely key for your health and well-being.
And maybe this raises an important question for you to think about, considering this whole range of breast conditions we've talked about and the different ways they can be managed. What does being proactive about your own breast health, or maybe the health of people you care about, what does that look like in your life?
That's a great question. And maybe another thought, with all the ongoing progress being made in, how we detect and treat these conditions, what aspects of the future of breast health do you find most encouraging or hopeful? It's definitely something worth mulling over.
Absolutely.
Thanks for taking this deep dive with us today.